Did you know that Medicare's Extra Help for Part D program can save beneficiaries like you an estimated $4,900 a year on prescription drugs? That's right, it's also called the Low-Income Subsidy, and while many people on Medicare struggle to afford their medications, a surprising number of people are out there who would qualify for help from the Low-Income Subsidy, but they never even apply for it because they don't know about it. If we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits, and in this video, I'll explain how the program works, what expenses it might help you save, and how to find out if you're eligible. I'll also be sharing who automatically qualifies for this subsidy without needing to apply at all. Don't forget to subscribe to our channel if you haven't already so that you'll be notified whenever we drop new videos about Part D. The Low-Income Subsidy is a federal government program to help people with low incomes save money on their outpatient medications. It helps beneficiaries with their Part D costs in several different ways. First, it can help to lower or eliminate monthly Part D premiums. Second, it eliminates or lowers any deductible that your plan might have. Third, it erases the Part D coverage gap, also called the donut hole, so that you don't pay more for the drugs in the middle of the year than you did earlier in the year. And lastly, it also lowers your copays that you spend on medications throughout the entire year. Let's take a closer look at what each of these mean to you if you qualify for the Low-Income Subsidy. Part D drug plan premiums in 2020 range from around $13 a month on the low side to over $190 a month for the most expensive plan. However, if you're awarded the Low-Income Subsidy, you will pay less for your drug plan. The level of your award is based on your income. Social Security will award the highest subsidy to those with the lowest incomes. A full subsidy award means that you will be given the full credit of the Part D premium benchmark for your state. So, for example, the 2020 benchmark for Texas is $20.78. If a Texas beneficiary receiving the Low-Income Subsidy enrolls in a Medicare Part D drug plan that has a lower monthly premium than the benchmark, the beneficiary will pay no premium for their Part D plan that year. The subsidy covers it entirely. If that same beneficiary applies for a Part D plan with a premium higher than the subsidy, then he or she will just pay the difference in premiums. In this example, if the beneficiary enrolls in a plan with a $30 a month premium, then they get a credit of $20.78, leaving them paying only $9.22 a month for their plan. The benchmark premiums vary by state and can range from around $20 a month to nearly $40 a month in Wisconsin, which has the highest benchmark in 2020. Now, some people qualify for a half subsidy or even a quarter subsidy, which just means that you will have a smaller credit toward the cost of your premiums. So, using our same example from earlier, a half subsidy award in Texas would mean a credit that is equal to half the benchmark. So in this case, a little over $10 a month that would be credited toward the cost of the Part D plan. Hey, we all love to pay less for our coverage, right? But here's the cool thing. The discounted premiums are not even the best part about qualifying for the Low-Income Subsidy. The best part about the subsidy is how it impacts your drug spending on your plan throughout the year. Every year, Medicare sets the maximum deductible for Part D drug plans, and most drug plans today do include that full deductible in their plan design. This is money that you have to spend on prescriptions upfront or out of your own pocket before your Part D plan benefits kick in. Depending on your level of qualification, the Low-Income Subsidy either eliminates or greatly reduces the deductible for you. This means you'll be able to get your medications at low copays either right from day one or after satisfying a much lower deductible than the standard deductible. This is really significant in 2020 or beyond because if you enroll in a drug plan with the full $435 deductible, but you qualify for the full subsidy via the HELP program, your deductible will be zero. On an average Part D drug plan, you may often find that copays for certain brand name drugs can still be quite expensive. It's not uncommon for drugs in Tier 3 to cost you a copay of $40 to $60 or more, and you'll pay more for that for Tiers 4 and 5. However, when you qualify for the Low-Income Subsidy, the copays on all your medications are reduced. The copays that you will pay for your medications will depend on where you fall on the federal poverty level scale, but typically the cost reduction is significant no matter where you fall on the scale. In most cases, you will pay only a fraction of the regular cost of the covered medication, and in some cases, you will pay zero for certain medications. Now, be aware that the reduction in the cost of medications only applies to drugs that are listed as covered medications on the plan's formulary. For this reason, it's very important to make sure that you enroll in a plan each year that includes most or all of your necessary medications on the drug formulary. The low-income subsidy also eliminates the coverage gap or donut hole. Though the ACA legislation has slowly closed the coverage gap to where beneficiaries now pay no more than 25% of the cost of their drugs, both during the initial coverage level and the gap, many drug plans choose to offer you a lower copay during the initial coverage period and then resort to charging the allowed 25% of the cost of the drug once your spending reaches the threshold where you fall into the gap. This can cause you to see higher prices for your drugs in the gap than before the gap. With the Extra Help program, you will never have to worry about paying 25% of the cost of your covered medications. You will have low drug copays all year long, no matter how many medications that you're taking. Now, let's talk about when you can change your drug plan. Most people on Part D can only change their drug plans once per year during the fall annual election period. People with a low-income subsidy, however, can change their drug plans once per quarter. This means that if you have mid-year changes to your medications and another drug plan would be more cost-effective for you, you can switch to that drug plan sooner than you would if you didn't have the subsidy. One last benefit of the Extra Help program is that if you're subject to a penalty because you did not enroll in Part D when you were first eligible, you do not have to pay the penalty while you qualify for Extra Help. So I'm sure all this sounds great and you're wondering how you can apply for the subsidy and whether you'll qualify. To qualify for Extra Help, you must have resources and income that are below a certain threshold that is set by the government each year. In 2020, if your resources are at or below $12,890 as an individual or $25,720 as a married couple living together, you may be eligible for the Extra Help program. If you're watching this video in a future year, you can easily find the current income limits online by simply searching Google for the current low-income subsidy limits. Now, what counts as resources? Resources include the value of things that you own, like checking, savings accounts, certificates of deposit, stocks, bonds, even mutual funds. It can also include any real estate you may own other than your primary residence, which does not count. Your car, household items, burial plot, burial expenses up to $1,500, these do not count. To qualify for Extra Help, your income must also be limited to $18,735 for an individual or $25,365 for a married couple living together. Even if your income is slightly higher than this, you may still be able to get some help, so Social Security encourages you to apply. Your Social Security retirement benefits usually do count as income, but if you're receiving any housing assistance or food stamps, those of course will not count as income. Before we wrap up, I want to also make you aware that people who qualify for Medicaid, supplemental Social Security income, or a Medicare savings program like QMB or SLMB will automatically qualify for Extra Help. If you receive a purple deemed status notice from Medicare in the mail, it means you have automatically qualified due to having Medicare and Medicaid or a Medicare savings program or SSI. You might also receive a yellow or green auto enrollment notice. This one means you qualify for both Medicare and Medicaid, but are currently getting your benefits through original Medicare. If you don't choose a Part D drug plan, they will automatically choose one for you and enroll you into it. If Social Security thinks you might be eligible for the subsidy, they'll send you a different kind of notice in mid-May about the program. You can then either apply through your state Medicaid office or at the Social Security website, which can be found at this link. For further details about the program, you can download the latest Social Security brochure entitled Understand the Extra Help with Your Medicare Prescription Drug Plan. It includes a worksheet to help you calculate whether you might qualify. All right, folks, that's it for our coverage on how the Extra Help for Part D program works. If you are still learning about Part D, be sure that you check out our other videos here on YouTube, which explain how Medicare Part D works and how and when you should enroll in Part D to avoid any late penalties. Thanks for watching, and we'll see you in the next video.